afternoon to you, team. You are most welcome to this clinic from Ponea Healthcare. I am Professor James Wilson Jaguga. I am a consultant obstetrician and gynecologist. I do lecture at Uzima University Medical School in Kisumu. We undertake our teaching of medical students at Jaramogi Oginga Odinga Teaching and Referral Hospital. We'll be talking today about infertility in reproductive health. Infertility is the inability of a couple to achieve a pregnancy after 1 year of sexual intercourse without using contraceptives. Predisposing factors to infertility are early sexual contact, multi-sexual partners, young age, we could call it promiscuity, and these predispose to sexually transmitted infections, which later could contribute to infertility. Other predisposing factors are if the lady does not have regular cycles, hormonal imbalances. Those could also eventually predispose to infertility. Causes of infertility could be from the female side as a result of chronic infections. They get pelvic inflammatory disease, and this can predispose to adhesion formation, endometritis, and salpingitis, and the tubal blockage could prevent the ova from transportation and meeting with the spermatozoa of the male. Other predisposing factors in the male could be also sexually transmitted infections. They could get orchitis, prostatitis, and sometimes you also get that for a male who has undescended testes may also interfere. Besides tubal blockage and STIs in male and female, you could also get situations whereby a woman is infertile because she's unable to produce, to ovulate. Yeah, could be congenital. And in the males, there could be a problem with the sperms, could be very few sperms, or could be abnormal sperms. Or sometimes a failure to achieve erection. I may also add that another factor which could contribute to infertility in females is certain growths which could be in the uterus, causing abnormal uterine bleeding like uterine fibroids. Infertility, as I've just said, is inability after 1 year of not using contraceptives and having regular intercourse and not achieving pregnancy, limited to that within that 1 year with the conditions I've said. We talk of fertility sometimes synonymously, but it reflects long period between deliveries. That is subfertility. And sterility is completely inability to conceive. A young girl who starts with irregular cycles, irregular periods, could even be having amenorrhea. A young girl who, when you look at her after in adolescent age, has got, for example, abnormal hairiness, we call it hirsutism. You could find even hairs coming on the chest, on the cheek, like a male. That means that you could start suspecting that she may, later on in life, have problems with infertility. A young girl that has been treated at a younger age with frequent sexually transmitted infections, you would obviously suspect that in her future life, she may not be able to conceive. A young man who probably has got what we call undescended testes, sometimes hypospadia, and sometimes they get hydrocele. If you notice those in a young age, you may. Late start of menstruation can also be a factor. Let me take this opportunity to thank the audience very much for giving me an audience. This is the first of a series of episodes that we are going to be having with Ponea Healthcare, which can be booked through the internet, ponea.com. So we'll be doing internet consultations. My contacts are available and my services. I do admit in all private hospitals in Kisumu. So those who want to see me can always access me through my phone numbers, email, and other contacts. Thank you very much.